everything is difficult until you know the right protocol and the right tool to make this easier. My name is Waleed Kurdi. I'm an endodontist from Egypt.
So what do you think about the dental world? Do you enjoy the event and its atmosphere?
Actually, yes, I enjoy Dental World so much. The atmosphere is nice. The organization is great. Everything went very well. So yes.
What do you think are the key clinical factors that determine whether a broken instrument should be bypassed or retrieved, and how can these be evaluated during the treatment planning?
Actually, the main key clinically to bypass or to retrieve is the position of the broken instrument. So I prefer myself, if the broken instrument is completely beyond the curve, to go for bypassing, which will be more conservative than to retrieve. But if the file is broken at a coronal level or even more coronal or before the before the curve, I prefer, of course, in that time to retrieve. So the main clinical factor or the main key clinical word here is the position of the separated instrument.
In your experience, what are the most common causes of file separation, and what preventative strategies can clinicians implement to minimize the risk?
Single use, this is for sure very important to single use the files, and also to use the right sequence or the right instruments to use or adjust the right parameters also for usage. To have, because I usually have this question, which file or how many times we have to use this file, I usually prefer not to answer this question because it's not the right question. The right question is not about how many times, it's about the manner how we should use the file, not how many times we should use the file.
Could you elaborate on what makes your protocol stand out?
All right. For my protocol for bypassing, I usually prefer to use specific kind of files with specific tools to avoid a little bit our normal human error factor. That's why I prefer to use the DFinder files from many companies on the reciprocating handpiece. In that way, I will decrease too much the incidence of problems during bypassing the broken file, which is, as usual, making false pathways or ledges or false transportation. And that's why I prefer to use the DFinder on the reciprocating handpiece. This is for bypassing. For retrieval, for sure, I prefer to do my direct access to the broken instrument with heat-treated controlled memory, big size files, instead of using the Gates Glidden. And then I follow my sequence on the troughing of the ultrasonic, and then I have the BTR band from Circumit to remove the file in a better, easier way.
What is the take-home message of your lecture?
The take-home message of my lecture was everything is difficult until you know the right protocol and the right tool to make this easier. It's my first time to Dental World as a speaker, and I'm sure it will not be the last time as a speaker or even as an attendant, because really it deserves. Dental World 2026, we are waiting for all of you.